Hello everyone, it is Dr. George here. This video I am going to be going over an NCLEX NGN next generation style question. For these videos, I'm only going to go over one question at a time because I want to break these questions down and I want to rationalize the answers so that you have a good understanding as to why the answers are the answers. All right, so you will see me looking down a little bit because I do have to read off the question, but once I'm done reading off the question, I'll be looking up to rationalize why the answer choices are the answers. So this question says, a 90-year-old male client was admitted to the unit from a nursing home with a low-grade fever and acute confusion. The client's son tells the admitting nurse that the client's father had a stroke 1 year ago that resulted in right hemiparesis and urinary incontinence, and the client has been in the nursing home for the past 7 months. The client has a long history of type 2 diabetes, which has been controlled. Until this morning, the client's son has not been allowed to visit the facility due to COVID-19 pandemic. During the visit today, the son noted that his father was lethargic, confused, and unable to stand. POC testing in the ED indicated the presence of multiple bacteria in the client's urine and a fasting blood glucose of 331. The client's blood pressure is 90/42. The nurse reviews the client's assessment findings and determines that the client most likely has which of the following conditions. Select all that apply. So this question is pretty wordy, pretty lengthy. So we need to go back into this question and find the things that are most pertinent to help us try to figure out and understand what may be wrong with this client. First of all, first things first, is a 90-year-old male client. It's a 90-year-old male client who lives in a nursing home. The patient has a low-grade fever and acute confusion. If you remember, scroll back to pathophysiology, understanding diseases. The patient is 90 years old, which means this is an elderly patient. They have a low-grade fever and they are confused. Nowhere does it say that this patient is usually or generally confused. So confusion is new. He lives in a nursing home, right? He had a stroke a year ago. If he had a stroke a year ago, that means the stroke is not the issue. Okay, so our patient is not having a stroke. He had a stroke a year ago. He has type 2 diabetes and his blood sugar is 331. That's really high. Okay, the next issue is that he's lethargic, he's confused, he's unable to stand, with a fasting blood glucose of 331 and a blood pressure of 90/42. So confused, unable to stand, a blood glucose of 331 and a blood pressure of 90/42. Now we have multiple options. It says select all that apply that could be wrong with this patient, okay? The first option says urosepsis. Second option says delirium. Third option says dehydration. Fourth option says COVID-19. Fifth option says DKA. Then we have cerebral vascular accident. And then we have hyperglycemic hyperosmolar syndrome. Okay, so urosepsis. If you don't know what urosepsis means, break the word down. Uro means urinary system. Sepsis means infection. Put it together, you have an infection in the urinary system. If you remember back from pathophysiology, this patient is confused. This patient has a low-grade fever. This patient is 90 years old. If they're 90, they're confused, they have a low-grade fever, chances are this patient may have some sort of a urinary infection. So urosepsis would be an option to think about. Okay, the next one is delirium. Delirium is usually when patients start to act out because they're ill. So they'll be confused, they'll be lethargic, they won't be able to recall things, they may even be violent. And a lot of times when you have elderly patients who have urinary tract infections or urosepsis, they will have some delirium. Delirium can be resolved once you fix the infection. So with urosepsis in elderly patients, you will see delirium. Okay, so I like those two options. The next one says dehydration. What in here would help me to indicate that my patient may be dehydrated? What would help me indicate is this blood pressure. This blood pressure is 90/42. If my patient's blood pressure is 90/42, my patient's blood pressure is low, which means my patient is hypovolemic, meaning their blood volume is low. If your patient's blood volume is low, your patient's blood pressure just may drop. And if your patient's blood volume is low, your patient's blood pressure drops, your patient is at risk for dehydration. Okay, so that would be an indicator. That low blood pressure would be an indicator that your patient would be dehydrated. Now, the next option says COVID-19. If we think about COVID-19, usually with COVID-19, our patients are going to have high fevers. They're going to have elevated white blood cells. Your patients may be confused with COVID, but these symptoms here that they're describing, especially with the low-grade fever, I wouldn't look too much into COVID just because the patient doesn't have enough symptoms to tell me that they have COVID. Okay, the patient has acute confusion, the patient has a low-grade fever. Those are not symptoms that are usually associated with COVID-19. Now, E says DKA. DKA is diabetic ketoacidosis. That's when someone's blood sugar is really, really high. Now, the patient's blood sugar is 331. They have acute confusion. Okay, now with DKA, usually if you're not sure about DKA usually affects patients who have type 1 diabetes. And diabetic ketoacidosis, that usually happens when your sugars are really high and your body can't break down the sugars to use the sugars as energy. So your body then goes to break down fats and proteins. And when your body starts to break down fats and proteins, your body creates what is called keto acids. And those keto acids is what makes you go into diabetic ketoacidosis. And that's when your patient goes through the metabolic acidosis. In this case, that wouldn't be the indicator for this patient. One, because the patient's blood sugar is 331. Secondly, the patient has type 2 diabetes. And usually with ketoacidosis, diabetic ketoacidosis will affect your patients that have type 1 diabetes, not so much type 2 diabetes. So we wouldn't look at COVID-19 and we wouldn't look at DKA. Now, could our patient be having a cerebral vascular accident? Now, your patient has acute confusion, and also your patient has urinary incontinence. That's a big indicator for a UTI. My patient has urinary incontinence. So with the cerebral vascular accident, the patient had a stroke a year ago, and the patient already has right hemiparesis, which means the right side is flaccid. It doesn't work as effectively. And they don't have no strength in that extremity. The patient had a stroke a year ago. If I suspected that my patient had a stroke, I would be looking for facial drooping, maybe slurred speech. Yes, the patient has a hard time getting up, but the patient has problems urinating. The patient has acute confusion. The patient has issues with their blood sugars as well as their blood pressure. The blood pressure is low. If someone was having a stroke, their blood pressure would be higher. Usually, if you're having a stroke, your blood pressure is not low. So that should be an indicator. The fact that he had a stroke a year ago, none of these signs or symptoms are indicative of a stroke. Okay, right hemiparesis, that happened from the stroke last year. The blood pressure is low. Usually, if you're having a stroke, your blood pressure will be higher. So I don't think this patient is having a stroke. The next one is hyperglycemic hyperosmolar syndrome. Now that usually happens with type 2 diabetics, if you're not familiar with that. With type 2 diabetics, they usually do not go through diabetic ketoacidosis. Only type 1 diabetics will go through diabetic ketoacidosis. Your type 2 diabetics will go through your hyperglycemic hyperosmolar syndrome. That's when they have the really high blood sugars, but they don't go through ketoacidosis. Okay, so they'll have the high blood sugars, they'll have the confusion, they can become dehydrated. If you remember from pathophysiology, your patients with type 2 diabetes who have high blood sugars can become dehydrated. Remember, they pee a lot. They have that polyuria, which can make them dehydrated. Okay, so the things that really stick out here in this question that makes sense, that would be the options, would be the urosepsis, because my patient has urinary incontinence, and my patient has a low-grade fever, and my patient is confused. If you remember about urosepsis, UTIs, your elderly patients are going to be confused. They will have urinary incontinence, and with having urinary incontinence, you should know that that increases your risk of UTIs. Delirium comes with infection. Acute confusion. Delirium is acute. Delirium can be resolved once we treat the problem, once we treat the infection. If your patient has urosepsis, it will be expected that your patient has delirium. Dehydration. My patient will have dehydration if they have a UTI. The reason being, they have an infection. If you have an infection, you're at risk for dehydration. Also, the blood pressure is low. If the blood pressure is low, that's hypovolemia. We're losing blood volume. If we're losing blood volume, we're losing fluid, right? So if we're losing fluid, that's going to put us at an increased risk for dehydration. COVID, not so much. It's a low-grade fever. Yes, my patient is confused. Yes, my patient does have a high blood sugar. Yes, my patient does have hypovolemia, but that's not the direction of COVID. Usually the fevers are really high. You might see elevated white blood cells. You may see elevated white blood cells. Your patient may complain of more so symptoms of feeling ill. They may have fatigue. They may have a fever, they may have weakness, they may have body aches, they may have chills. None of that was described here as far as COVID-19. DKA, I already told you that DKA is usually associated with type 1 diabetes, where they go through the ketoacidosis. This patient has type 2 diabetes, so that may not necessarily be their case. Cerebral vascular accident, they had that last year. There are no signs and symptoms here that will tell you that your patient is having a cerebral vascular accident. No slurred speech, no numbness and tingling. The patient already has right-sided paralysis from a stroke from last year, so we can't count that as a new symptom, because that's a symptom that they've had after the stroke that they had a year ago. The last one, the hyperglycemic hyperosmolar syndrome, I like that because, like I said, with type 2 diabetes, when the sugars are high, they will have this syndrome, hyperglycemic hyperosmolar syndrome, which means the sugars are really high. Your patients may pee. He's having the incontinence, right? His sugars are really high, and it's causing him to become confused. So those are the options that really make sense: urosepsis, delirium, dehydration, and hyperglycemic hyperosmolar syndrome. When you're looking at these questions, really take a second. If you can, write down the things that stick out to you, because immediately as I was reading, 90 years old stuck out to me, especially when I saw 90 years old, nursing home, low-grade fever, acute confusion. Before even continuing to read the age, where he was living, the acute confusion, and the low-grade fever, I automatically thought UTI. If you don't know what urosepsis is and you're looking for a UTI, you may not see UTI. So become familiar with your terminology. The client having a stroke a year ago, that's fluff. They're trying to trick you to see if you know what an acute stroke looks like and what a non-acute stroke looks like and what a patient looks like after they've had a stroke. The right-sided paralysis, that's also a fluffer in there to try to confuse you. That is residual from the stroke from last year, so that's not really important. The type 2 diabetes, yes, that is important because his sugar's really high. Sugars are really high, you will be dehydrated. You can get confused, okay? The next thing that stood out to me was the blood pressure. That blood pressure of 90/42. you're dehydrated, you're losing fluid volume. You can do that with diabetes, and you can do that with urosepsis. So when you're looking at this, break this stuff down. Look at what is a filler, what is fluff, what doesn't really need to be there, and look at what the pertinent information is that's striking, right? That's coming out to you that'll help you figure out what's really wrong with this patient. Okay, so I hope that this did help. You will see questions like this. I will come back with more NGN style NCLEX questions so that we can kind of break things like this down, because the longer the question, they're going to add a lot of fluff in there to try to confuse you, to make you pay attention to things that are not important. The biggest thing is take the fluff away. The fluff is just history. Right? The old CVA is important to know, because I need to know that I can rule that out based off of the other symptoms that the patient has. Because if nobody would have told me that this patient had a stroke a year ago with right-sided paralysis, I would have thought this patient was having a stroke. But seeing as he had a stroke a year ago, the residual was right-sided paralysis, I'm not worried about that, because that's old. Those are old symptoms. I'm looking at what's pertinent and what's happening right now. The biggest thing that should strike you is the confusion. The confusion should be the biggest thing that should strike you. When a patient is confused, I need to know, because they're not at their baseline. So what are different things that can happen to a patient, right, when they're confused and they're elderly? UTIs. He's a diabetic. Look at that. Pay attention to that. Look at the things that are primary that you should be focusing on to help you figure out what's wrong with your patient. I hope this helped. I will have more questions coming and more rationalizing with these questions to help to break it down, to make it make more sense to you. If you have any questions or any suggestions on any questions that you would like me to address, I feel free. Please leave that in the comments, like and subscribe, and I will have more questions coming your way. For now, it's been Dr. George. I hope you enjoyed this question. I will have more questions coming your way, as well as nursing content about things that go on in nursing school, as well as nursing practice. Bye for now.